If you're having your hearing tested for the first time, it's normal that you might have questions about what to expect. I'm Dr. Ariel Arista, and today I'm going to walk you through the process from your initial hearing test to the fitting of your new hearing aids. When you first get to our office, you may notice that the front doors are locked. This is to limit the number of patients in the office and to keep our waiting area clear. In order to get you checked in and ready to see your provider as soon as possible, please give us a call at the number listed in the front door and let us know that you're here. Once your patient room has been completely cleaned and sanitized, a member of our front office staff will get you in and seated, ready to see your provider.
All right. In the last 48 hours, are you experiencing any of the symptoms?
If you haven't already filled out your intake paperwork at this time, you'll be asked to do so. In order to best serve you, please bring your most updated medical insurance information with you. Based on the intake paperwork that you filled out, your provider may have a few follow-up questions about your medical history. At this time, they'll also want to learn more about the hearing challenges you've been experiencing and how they're impacting your day-to-day life. This will give them a good idea of where you go, what you like to do, and how your hearing challenges are impacting your quality of life as well as that of your family and friends. Now we can get started with the exam. To start the exam, we'll start by looking in your ears. Once we've verified it's safe to proceed, we'll run a variety of tests that assess how your auditory system is functioning. This will include tests of the middle ear, the inner ear, as well as word tests to determine how clearly you hear and understand speech. At the end of the exam, we'll review the results and explain them in non-technical terms. We'll review how any decrease in your hearing may be causing the hearing challenges that you're experiencing. There will be plenty of time for questions and answers during this portion of the evaluation. At the completion of testing, you'll be able to answer the big question of what can I do about my hearing challenges? Your provider will go over all of your options, including medical and audiological possibilities. If there's anything we're concerned about medically, we'll be able to recommend physicians you can see to address it. If you would benefit from hearing aids or assistive devices, we'll be able to review the best options for you. Once you and your hearing care provider have determined that you would benefit from hearing aids or assistive devices, we'll go over all of your options, including pricing and if you have any type of insurance benefit. This will include letting you see and try on different examples of hearing aids that would work best for you. Depending on your provider's recommendations, you may also have the option to take the hearing aids home and try them risk-free in your day-to-day life for 1 week. Your hearing care provider will be able to answer all questions you have about hearing aids and assistive devices and lead you towards the best options for your hearing needs and your lifestyle. If you've decided to move forward with hearing aids, congratulations! You've taken a big step on your journey toward better hearing and an improved quality of life. At this time, your provider will schedule you for your hearing aid delivery appointment about 2 weeks from today. At your delivery appointment, your provider will connect your hearing aids to the computer and using software within the computer, program them specifically for you. They'll do this by starting at a modified level for your hearing loss. As you adapt to that modified level, they'll slowly bring the hearing aids up until they meet your full prescription. This adaptation period can vary from person to person and can last anywhere from 30 days up to 6 months. After your delivery appointment, you'll continue to see your provider on a regular basis during your adaptation period. For some people, this will be weekly for the first few months, while for other people, it'll be 2 to 3 visits only. Again, this adaptation period varies from person to person and will be customized based on your hearing needs and your learning style. It's important to clean and service your hearing aids regularly to ensure that they're working well. It's also important to keep your ears clear and free of wax and debris to make sure that you're hearing well. In order to help you keep up with this, we will see you every 6 months following your adaptation period and retest your hearing every 3 years or sooner if we suspect a change. Here at Whittier Hearing Center, we treat you as family and strive to help you live your best quality of life possible. Our mission is to help as many people as possible hear the best that they can today, tomorrow, and always. Thank you so much for taking the time to watch this video and allowing us to walk alongside you as we find the best solutions for your hearing loss.